You're getting used to this, huh? Okay.
I am. Good morning, everybody. This is the AACP Australian chapter, and we welcome you as we go into preparation mode for our global summit next week on non-CPAP therapies for OSA patients. We've got an amazing week lined up for you, starting on Monday and going until Saturday. We've got 6 lectures ready for you. And we've presented this before in Australia, and it got such amazing traction that we thought we'd like to actually take it global. So we're looking forward to sharing this with our global audience and welcoming everybody around the world. If you haven't yet registered and you're seeing this on our Facebook site, please go to our website, www.aacfp.com.au, where you can register for this free and mind-bending summit. And we're looking forward to bringing you really incredible information to any practitioner working in the sleep field. It's my pleasure today to introduce Meetal and to have him join us. Good morning. Meetal will be our second presenter next week, and he's going to talk about case assessment for the sleep-disturbed patient for mandibular advancement splint therapy. So, Meetal, would you like to let the audience know where you are in the world and why it is you come to be presenting on this topic in the Global Summit next week?
Sure, Charlotte. So I'm based in Melbourne now. I was originally from the UK, trained in the UK, but I've been in Melbourne for about the last 15 years. And I had a keen interest in restorative dentistry, which eventually led me into occlusion and eventually led me into orofacial pain and dental sleep medicine. And for approximately the last 8 years, I've dedicated pretty much most of my practice to orofacial pain and dental sleep medicine.
Fantastic, thank you. And why do you think this topic is an important part of our Global Summit next week, and why do you think we've positioned it as our second lecture?
So, I mean, the important thing is that, as we're all aware, that sleep disordered breathing is just so common now, and it's just going to get worse and worse. And we also know there's so many patients who just can't tolerate CPAP. And as a first-line treatment that is non-CPAP, the mandibular advancement splint is probably the most common treatment that we can offer to these patients. And they need it because a lot of people drop off using CPAP after a year or 2 or 5 years. And so then it's so important to know the patients that we can help, what modifications we can do to try and help them, and when we need to pull in other things to try and give them as successful an outcome as possible.
Brilliant, thank you, and I couldn't agree more. And what do you think the listeners will learn from your presentation next week? What things will they be able to bring back to their practical clinical situation?
So my aim is to give you an ability to clearly assess your patient, starting from medical history, dental history, and then a clinical assessment, and doing it in a very systematic manner so that you can pick out, first of all, the red flags, the ones that you really shouldn't be trying to treat with a mandibular advancement splint, or the ones where you've got a lower chance of success. And I also want you to understand what the predictors of success are so that you can convey that information to your patient, and where you also then need to consider maybe doing some other kind of treatment before giving the mandibular advancement splint, or considering adjunctive therapy. And so in a nutshell, trying to treat your patient in the most successful manner.
Brilliant, thank you. And this lecture was so well received when we did it earlier this year in Australia to our Australian audience. So I know that people around the world are going to benefit enormously from what you're going to share with them, Meetal. Really thank you for doing this for us.
Thank you, Charlotte.
So if you've not yet registered, please visit our website, www.aacfp.com.au, and register. As I mentioned, this is a free event. It runs for an hour and a half each night. It starts on Monday, the 2nd of November, and runs until Saturday. Monday to Friday, we're live from 7:30 p.m. till 9 p.m. Australian Eastern Summertime. So please make sure you have that time set in your diary. And if you have already registered, watch out for the email that you'll be receiving probably later today, inviting you to join our Facebook group. There is a specialized group for this. This will not be running on our Facebook site, so you do need to register. I can't reinforce that enough. Thank you to everybody for joining us this morning. Thank you for your comments. We look forward to being with you again later this afternoon when I introduce you to Dr. Joseph Ryan and his wonderful topic as well. Thank you, Meetal, for spending the time with us this morning.
Yeah.
And we look forward to seeing everybody next week for the Australian Chapter Global Summit. Thank you. Bye for now.
Bye-bye.